13. Early signs of heart failure. Have you ever stopped to wonder if that shortness of breath climbing just a few stairs, or waking up in the middle of the night gasping for air, could be more than just getting older? What if those moments are actually your heart crying out for help? The truth is, your body often whispers before it screams. Right now, it might already be sending you signals, small warning signs that could literally save your life if you catch them in time. The heartbreaking reality is that more than 6 million Americans are living with heart failure, and most of them don't realize what's happening until it's dangerously late. That's why in this video, we're going to uncover 13 early signs of heart failure that many people ignore every single day, and some of them might shock you. Like why suddenly needing extra pillows at night could point to something serious, or why bending down to tie your shoes leaves you more breathless than it should. By the end of this video, you'll know what to look out for, when it's time to act, and how listening to these subtle warnings could mean a longer, healthier life. Sign 1. Shortness of breath on activity. Let's start with one of the most common warning signs: shortness of breath during ordinary activity. This isn't the heavy breathing you expect after exercise. This is getting winded halfway up the stairs you've climbed for years, pausing to catch your breath on the short walk from the car to the store, or needing to stop after carrying a small grocery bag. Inside your body, your heart is like an engine. When it isn't pumping strong enough to move oxygen-rich blood, your lungs have to work harder and you feel out of breath faster than you should. Many people shrug it off and say, "I'm just getting older," or "I'm out of shape." But when everyday chores start feeling harder week after week, that's not normal aging. It can be a sign that your heart is asking for help. If you've noticed this happening, type 1 in the comments. If not, type 0. Your response helps us understand what signs matter most to you, and it shows others they're not alone. Sign 2. Needing more pillows to sleep. Another sign that often creeps up slowly is the need for more pillows at night to breathe comfortably. You used to sleep flat on your back without a problem. Then you added 1 pillow. Later, it became 2, and before long, you found yourself stacking 3 pillows or even moving to a recliner because lying flat makes you feel like you're suffocating. What's happening inside is simple. When you lie down, gravity isn't pulling blood into your legs as much, so more fluid stays near your chest. If your heart is weaker, it can't handle that extra volume, and some of it seeps into your lungs, making it harder to breathe. Many people think it's acid reflux, a stiff back, or just personal comfort. But when this change happens slowly over time, it can be your heart waving a red flag. If you've noticed that your pillow count has quietly gone up over the past months, don't ignore it. Comment pillow if this sounds like you, and let's see how many of us share the same experience. Sign 3. Waking up gasping for air. One of the most frightening signs is waking up in the middle of the night gasping for air. Doctors call it paroxysmal nocturnal dyspnea, but you don't need to remember the fancy words. You'll remember the feeling. You're asleep, peaceful, and then suddenly you wake up panicked, your heart pounding, struggling to breathe. Some people rush to sit upright, others head for a window just to feel fresh air. It usually happens a few hours after falling asleep, when fluid that's settled in your legs during the day shifts back into your chest and lungs. According to Wikipedia's overview of heart failure, this nighttime breathlessness is one of the hallmark symptoms that people often mistake for nightmares, anxiety, or even sleep apnea. The key difference is that it fades only after you sit up or stand for a few minutes. If this has ever happened to you, please share with us. Drop a heart icon in the comments so others know they're not alone. Sign 4. Swelling in ankles and legs. Another very common sign is swelling in your ankles, feet, or lower legs. At first, you might just notice your socks leaving deeper marks at the end of the day, or that your shoes feel tighter than they did in the morning. Over time, your ankles can start to look puffy and uncomfortable. This swelling happens because when your heart isn't pumping blood efficiently, fluid begins to build up in your lower body. Your kidneys may also hold on to extra salt and water, which only makes the swelling worse. Doctors often call this peripheral edema, and it's one of the most visible red flags of heart failure. A simple check at home is to press your finger gently into the swollen area. If a dent stays for a few seconds, that's a sign of fluid buildup. Many seniors think it's just from standing too long or eating too much salt, but when the swelling is persistent and appears in both legs, it's time to pay attention. If this sounds like something you've noticed, comment yes below. It may help someone else recognize the same problem. Sign 5. Rapid weight gain in days. Another warning sign that many people overlook is sudden weight gain over just a few days. We're not talking about gaining a couple of pounds after a holiday meal. This is when you step on the scale in the morning and notice you're 2 or 3 pounds heavier than yesterday, or 5 pounds heavier within a week, even though you haven't been eating differently. That kind of quick change usually means your body is holding on to fluid because your heart isn't pumping well. Doctors often tell patients to weigh themselves every morning at the same time, after using the bathroom and before breakfast, because the bathroom scale can actually act like an early warning system. According to heart health guidelines, this type of rapid gain is a major red flag. The good news is that catching it early can help you and your doctor adjust treatment before things get serious. If you agree that weighing yourself daily is a simple habit that can save lives, comment 1 below. You might encourage someone else to start tomorrow. Sign 6. Frequent urination at night. Getting up once at night is common as we age, but waking 3 or more times most nights is a different story. This frequent nighttime urination, called nocturia, can be a sign your heart is struggling to handle extra fluid. During the day, fluid often settles in your legs and ankles. When you lie down, that fluid moves back into your bloodstream, your kidneys get a sudden rush to filter, and you end up making repeated bathroom trips. Many people chalk it up to age or, for men, the prostate. But when nocturia shows up alongside ankle swelling, sudden weight gain, or shortness of breath, it may be your heart asking for attention. A few simple checks help. Note how many times you get up at night, weigh yourself each morning, and see whether elevating your legs for an hour before bed reduces trips. If this sounds familiar, don't ignore it. Mention it to your doctor. And if you want more senior health tips like this, tap subscribe so you won't miss the next video. Sign 7. Night cough or wheezing. A nighttime cough that shows up mainly when you lie down can be more than allergies or a lingering cold. This cough is usually dry and stubborn, and it may come with a soft wheeze that makes it hard to sleep. Some people even notice a small amount of frothy, pink-tinged mucus. That is a stronger warning that fluid is reaching the lungs. What's happening is simple. When you lie flat, fluid that has built up in your body during the day shifts toward your chest. If your heart is weaker, that extra fluid can leak into the lungs, and your body responds with a cough. The timing is the clue. Worse when flat, better when you sit up. If this sounds familiar, please don't ignore it. Keep a brief note of when it happens, how long it lasts, and whether you also feel short of breath. Share those details with your doctor. Early attention can help you breathe easier, sleep better, and stay safer. If you ever cough up pink, frothy mucus or feel severe breathlessness, seek medical care right away. Sign 8. Night cough or wheeze when lying down. Have you ever noticed a nagging cough that seems to appear only at night, right when you lie down to rest? Maybe it wakes you up, or maybe your spouse has pointed out that you cough more when you're in bed. This isn't the same kind of cough you get from a cold, allergies, or a tickle in your throat. Instead, it often feels dry, irritating, and sometimes comes with a faint wheeze. Why does this happen? When you're lying flat, gravity no longer helps drain fluid away from your lungs. For someone whose heart is not pumping as strongly as before, fluid can slowly build up in the chest. Even a small amount of that extra fluid can irritate your airways, and your body's natural response is to cough, almost like it's trying to clear something that isn't really there. Many people brush this off. thinking it's allergies, the mattress, or even the air in the room. But if the cough happens most nights, especially when you lie flat, it could be a quiet sign that your heart is under extra strain. Some people even find the cough improves when they sit up, use extra pillows, or move to a recliner. That relief isn't just about comfort, it's often because the upright position reduces fluid in the lungs, making it easier to breathe. It's important not to ignore this pattern. A nighttime cough linked to heart failure usually develops gradually, so it's easy to miss or dismiss. But catching it early can make a big difference. If this sounds familiar to you, think of it as your body's gentle way of asking for a checkup. Talking to your doctor can help rule out other causes and give your heart the support it may need. Your health and comfort matter. Don't assume coughing at night is just part of aging. Sometimes it's your body's way of whispering for attention before bigger problems show up. Sign 9. Palpitations or irregular pulse. Have you ever felt your heart beating in a way that just didn't seem normal? Maybe it suddenly raced while you were sitting still. Maybe it fluttered like a tiny bird in your chest. Or maybe it skipped a beat and then came back with a hard thump that made you pause. These feelings are called palpitations, and they are one of the body's ways of saying, pay attention. When the heart is under stress, it can fall into irregular rhythms, the most common being atrial fibrillation. This doesn't just make you feel uneasy, it can make your heart less effective at pumping blood and can increase your risk for blood clots or even stroke. Some seniors describe it as a pounding in the chest, while others say it feels like flip-flops or rolling inside. It's tempting to ignore these episodes if they only. Your heartbeat is the rhythm of your life. Paying attention to its changes is one of the simplest and most powerful steps you can take to protect your health. Sign 10. Dizziness or near fainting. Feeling dizzy once in a while can happen to anyone, like if you stand up too fast after sitting for a long time. But when dizziness becomes frequent, stronger, or shows up during simple activities, it can be a sign that your heart isn't pumping enough blood to your brain. Some people describe it as the room tilting, a sudden wave of lightheadedness, or even the feeling that they might black out. When the heart is weak, it cannot always adjust blood pressure quickly enough during changes in posture or mild exertion. The result is less blood flow to the brain, leaving you off balance. For older adults, this isn't just uncomfortable. It raises the risk of falling, which can lead to serious injuries and long recovery times. It's easy to blame dizziness on medications, dehydration, or an inner ear problem, and sometimes those are the causes. But if your dizzy spells appear along with shortness of breath, swelling in the ankles, or an irregular heartbeat, they are worth serious attention. Keep track of when they happen and share that with your doctor. Your balance is precious. Protecting it means protecting your independence and your safety. Don't ignore this signal. Your body is trying to tell you something important. Sign 11. Abdominal bloating, poor appetite, or early fullness. Sometimes heart problems show up in the stomach instead of the chest. Have you noticed feeling bloated even when you haven't eaten much? Or losing your appetite because food just doesn't sound good? Some people sit down to a meal, take only a few bites, and already feel full. This is called early fullness, and it often happens because the heart isn't pumping strongly enough. When blood flow to the stomach and intestines decreases, digestion slows down. At the same time, fluid can back up into the liver and abdomen, causing pressure, discomfort, or nausea. It's easy to think these symptoms are related only to digestion, but when they come with swelling in the legs or shortness of breath, they may actually be linked to your heart. Many seniors notice their clothes feeling tighter around the waist, even when their weight hasn't changed much. That's often from fluid, not fat. If this sounds familiar, write down when it happens and how much you were able to eat. Sharing these details with your doctor can help connect the dots. Remember, your digestive system and your heart are closely connected. Listening to your gut can sometimes mean protecting your heart. Sign 12. Bendopnea. shortness of breath when bending forward. Have you ever bent down to tie your shoes, pick something up from the floor, or lean over the sink, and within seconds felt short of breath? That sudden need for air when you bend forward has a medical name: bendopnea. It might sound unusual, but for people with heart problems, it's surprisingly common. Here's why it happens. When you bend at the waist, the pressure in your belly and chest increases. A healthy heart can handle that extra pressure without any trouble, but if your heart is already struggling to pump, that extra push makes breathing harder almost right away. It's not about being out of shape or stiff, it's about how well your heart is working under pressure. Doctors consider bendopnea a very specific sign of heart failure because healthy people rarely experience it. If you notice this happening often, pay attention to the pattern. Does it happen every time you bend? Does it ease when you sit back up? Writing these details down can help your doctor see the full picture. Your daily activities matter. Something as simple as bending forward should not leave you breathless. If it does, think of it as your heart quietly asking you not to overlook it. Sign 13, cold hands and feet or narrow pulse pressure. Have you noticed that your hands and feet often feel cold even when the room is warm? Or maybe your fingertips and nails look pale or even bluish at times. This happens because when your heart is weak, it has to make choices. It sends blood first to the brain and other vital organs, and less of it reaches your fingers and toes. That's why your extremities may stay cold no matter how many socks or blankets you use. Another subtle clue is something doctors call narrow pulse pressure, which means the difference between the top and bottom numbers of your blood pressure is smaller than usual. It's a sign that your heart isn't pushing out enough blood with each beat. Cold hands and feet alone don't prove you have heart failure. Many things can cause them, but when they show up with other symptoms we've talked about, they complete the picture. The important part is not to ignore them. Pay attention, write down what you notice, and share it with your doctor. And here's something to look forward to. In our next video, we'll be talking about simple, senior-friendly food habits, how to eat in ways that protect your heart, boost your strength, and even lower your risk of stroke as you age. Stay tuned, because those everyday choices at the table can be just as powerful as medicine. If you've noticed any of these 13 signs in your own life, please don't panic, but don't brush them off either. Heart failure does not happen overnight, and when it's caught early, there are many ways to manage it with today's treatments, small lifestyle changes, and regular care from your doctor. The important thing to remember is that these symptoms often creep in slowly. They may look like normal aging, but when you pay attention to the patterns, your body is giving you clues before things get serious. Early detection really can save lives. Paying attention, taking notes, and talking with your doctor are simple steps that protect your health, your independence, and your future. And if you want to keep learning more about how to stay healthy and strong after 60, don't stop here. Our next video shares practical senior health tips, from eating habits that lower stroke risk to daily choices that boost energy and balance. Subscribe now and keep watching for more senior health tips that matter to you.